Hey everybody, this is Dr. Lloyd from Adjust.clinic in Petaluma, California, chiropractic office. And today I want to talk to you about whiplash injuries. Now, whiplash injury, of course, is mostly a neck injury, but an injury to the whole body that comes from an automobile accident. Now, a whiplash injury is one of the most common injuries that we see in our office. And it might be a fresh injury that happened just yesterday, or it could be an injury from 10 years ago, but a lot of people get into whiplash injuries. There are a lot of people who suffer from car accidents, especially in this part of California, where, let's face it, you need to drive your car to get anywhere you need to go. So we take a special interest in whiplash injuries here in our clinic. Now, when you have an injury like this, usually a whiplash injury, you're hit from behind, but it could be that you're hit from the side. But there are certain structures of the neck that can become injured in this case. So, for example, a ligament can become sprained in your neck. So if you look at the neck, it's consisting of 7 different bones, and there are ligaments on the front of the neck and ligaments on the back of the neck that support and stabilize your neck, whether it's staying still or through its range of motion. And there's a specialized ligament called the disc between each bone, and that can become injured too with a whiplash injury. And so surrounding the bones, you have muscles that move and also support and stabilize the neck. And with the whiplash injury, they can become strained. Muscles get strained, ligaments become sprained. And there are also nerves, pairs of nerves that leave the holes between the bones in the neck and go down the arm. There's also a spinal cord that goes down through the central canal of the neck to the rest of the body. But oftentimes in a whiplash injury, we'll see nerve injuries where you're left with numbness or tingling in your hands. And also, with a whiplash injury, you might have a concussion. When you are hit from behind, your head bounces to the head restraint on your car seat, and this can make your brain bounce around from side to side or front and back. This can give you a concussion. So sometimes you're left with symptoms such as forgetfulness, trouble concentrating, irritability, mood swings, or even like blurred vision, trouble focusing, altered smell or taste. So these are the kinds of injuries that can happen with a whiplash injury. So our clinic takes a special interest on car accidents or whiplash injuries or neck injuries. And when you come into our clinic, we first start out with a consultation. We do a consultation that consists of asking you the mechanism of the injury, how it happened, when it happened, what were some of the circumstances. So we want to know if you were wearing a seatbelt, if you were aware of the impending injury before it happened. Did you brace up for it? What was your head restraint position? Most cars are pretty safe nowadays, but sometimes older cars can have head restraints that can go up and down. And if it's in the down position or if it's too far away from your head, that can give you more of an injury. So also the consultation it consists of asking you your medical history. Just like any chiropractic encounter, we want to know medical history, so we can factor that into what's causing your pain or what's causing your biomechanical dysfunction. So speaking of biomechanical dysfunction, the next thing we're going to do is check the range of motion of your neck. With a fresh injury, it's painful to move, the muscles might be swollen. We want to check the range of motion and document that. We might even use our KinetiSense biomechanical lab to video the range of motion, measure it with a digitized camera, and provide a report to put in your notes to document the injury. Next thing we want to do is we want to check your neurological examination. So we want to see if there's numbness or tingling in your fingertips. We want to know if there's any muscle weakness that you're left with because of the injury. We might check vibration, pinwheel, and we'll take a look at the cranial nerve examination if that's indicated too. And of course, we'll do an orthopedic examination. We'll do some orthopedic tests like cervical compression test or Sperling's test that can point to where how the injury damaged the different parts of your spine. And of course, we'll do a spinal examination with it too. So when I do a spinal examination, I want to know what parts of the spine are restricted in motion and what parts might be moving too much. And so spinal examination, of course, is part of the whole procedure to getting you better. And of course, like I mentioned before, we use a KinetiSense digitized biomechanics system to check range of motion. But also, when you start to get healthier after the injury, we want to maybe do a KinetiSense advanced movement screen, a CAMS test, where we check your balance, the power and coordination of your legs. We want to know about your flexibility by checking you into an overhead squat or an overhead single leg lunge, backward lunge. And this is put together into a report that gives you a score of how you are biomechanically. This is a very important part. And if your injury is bad enough, we might send you to our radiology facility in Santa Rosa to get some motion x-rays done. Motion x-rays can show us any kind of instability that might have occurred because of the injury. And so, of course, in our clinic, we always provide some sort of relief on the first visit. We do the examination, we do the orthopedic testing. That might make you a little bit sore, but we also do some treatment to help restore range of motion so you'll have some relief. And so in most cases, in my experience, when you have an adjustment and some treatment on the first visit, you're going to end up with relief too. And we also have a 9-minute wait policy. We strive to be on time every time. We want to respect your time. If you are trusting us with your health, we want to respect your time. And so we have a 9-minute wait policy. We never want you to wait more than 9 minutes. Get you in and out. The first visit in our clinic might last between 30 and 45 minutes. A routine visit, receiving an adjustment and some other therapies, might last between 5 minutes and 20 minutes, depending on what we're doing. So we want to respect your time. These car accidents are covered 100%, especially if we're working with your med pay or with an attorney. All these bills are going to be covered for you, so you don't have to necessarily worry about paying out of pocket for these visits. Now, if it's just a minor injury, you might have to pay out of pocket. But if you're working with an attorney and the attorney feels that the case is strong enough to have the car insurance company pay for everything, then that would mean no out-of-pocket cost for you. And we want you to get checked out as soon as you can after an injury. I often see in my clinic, old injuries eventually lead to chronic pain. The big factor in here is getting your biomechanics back up to making you move well and move properly with the range of motion of your neck, your low back, and the muscle strength for both of those. So we don't want you left with chronic pain. You're going to heal anyway, no matter what you do, but we want to make sure that you heal with good function. So we look forward to meeting you. We don't like that you had an injury, but if you had an injury, we're here to help you out. The number here is 707-658-2534, or you can go to our website, adjust.clinic, or if that sounds funny to you, adjust.clinic.net. You can go to the upper right-hand corner and click through where it says book an appointment, and you can book a complimentary neck injury, whiplash injury, personal injury consultation with me, and we can decide if we can help you or not. Thanks for watching. I'm Dr. Todd Lloyd with Adjust Clinic in Petaluma, California, and I look forward to meeting you soon.